Okay, so the next thing that we're going to record here is our orders. So if we pop up to the top here, that's orders. And here we can see there's already orders in the system here. You can see some imaging orders, lab orders. A lot of times if you just want to click, common order set, that will bring up a lot of things. We can put the patient on a cardiac monitor, put an IV in the patient. If we want to put an EKG, do an EKG, we have an indication, and we can just type that in. Here are the basic blood work labs, so we can click off a CBC. Usually it won't ask you if it's necessary, CMP, what have you. The normal labs will be in here. If you want something specific, sometimes you can go to this sidebar over here where it has a little bit more specialized testing, whether patient had a seizure or what have you. And basically you can click off labs that you want to get for the patient. Also here we have some imaging, chest x-rays. This is usually just basic imaging, the normal things. And then we'd click enter just like we normally do with everything else, and that takes us back to the chart. If we click back in orders, we can get back and we can see what we put in as orders here. And again, as I mentioned, if you want to do something more specific, sometimes there's more specific things in other tests. Also under CAT scans, that will have more CAT scans that you can choose from. So this is the abdominal pain order set. You got a few different things. CAT scans, you can click on CAT scans. That will give you some other options. Fast Track will give you other x-ray options, and ultrasound will give you ultrasound options. You can also free text here. So if I wanted to do a CT angio, so radiology and lab free texting are available here. Also, if I want to order a T4, normally a little drop down will show up here and I can click off those things. So imaging, labs, those things can happen here. And then here, these can also be free texted, and these are going to be your nursing orders. Now next, I clicked on medication services, which is also from the orders tab. Now this will bring up all of our medication orders, things that we're ordering for the patient. If you go to group, a lot of these are already done for us, which makes life a little bit easier. So say we just went into IV fluids. Now we can click IV fluids. That's going to be a 1,000 milliliter bolus, and then we click enter in order to order that for the patient. And then you'll see now that it's ordered, and it'll be clicked off by the nurses once that's done. You'll have other orders as well in here. This is a respiratory order set, so if we're ordering albuterol for the patient, we can also change our dose. So if we want to give a bigger dose, we can change that around. We can change around the units. We can change around the routes. But these are just some common doses and common order sets that we'll use. A lot of times for the albuterol, you might see you need to put in an override. You can just put in an override and then click enter. With the respiratory orders, in addition to put the medication like we did here in our order set, we're going to have to go back to orders here, go to respiratory, click here, and then this is the test environment, so that's not included here, but you can have a place where you can click for the respiratory therapist to initiate the neb. So in addition to the medication that you're ordering, also an order to the respiratory therapist to give the patient a neb treatment. Now if we go back to medications, so we'll go up to orders. So if we go back to orders or medication services here, we see the orders that we put in already with the doses. They haven't been clicked off by nursing yet, where they're still red. And then we can also free text medications or whatever we want to put in. So search, here we can search medications. So say it wasn't in the group order set, we can always just click things off and you'll see some medications that will come up. So you can always just free text them as well. And that would just be in the search box. And then lastly, after we went to orders, medication services, the last little box here is our results. And we've already attached those to the chart like we talked about. We're clicking that box right up here, entering it onto the chart, and then that will include it on the chart. That will include it in the chart so we can see it on that left-hand margin in the chart, but we'll also include it if the patient is discharged. It will also be included on their discharge paperwork as well.